Methodist Hospital of Southern California presents a Medical Minute on hip replacement with Dr. Daniel Laster.
Hip replacement is when the diseased cartilage is removed from the body and replaced with metal and plastic. I will bring the patient into the operating room. The patient will be placed on a specialized table for what I do, which is the anterior approach to the hip. This allows us to do the operation through a small incision where we don't have to cut any muscle. The surgery takes about an hour to 2 hours. We go in there and we remove the arthritic ball and we remount the socket, place an artificial cup in the socket. We then put a metal stem down the shaft of the thigh bone, put a ball on top of that, reduce the hip, and close up the incision. I like to get the patients up right away, oftentimes that same day. Therapy then proceeds twice a day. Patients are usually in the hospital for 2 to 3 days. And at that point, most patients will go home and receive therapy at the house. Occasionally, the patients will require a rehab stay, perhaps a week or two. I'll see the patients back in about 2 weeks. And at 2 weeks, the patients are still on crutches and canes and walkers, but by 6 weeks, they're usually off all that stuff. I think the success rate of hip replacement is probably on the order of 95 to 98%. Patients get back to golfing and tennis and hiking and all the things they usually like to do.